Doc Eric, I'll start with you. Uh, Give us an update on where we are. Yesterday, I remember reporting we were in 4 regions. Now we're saying 5 regions. Kamusta po ba ngayon ang outbreak?
Well, we're still with the 5 regions, no, NCR, Region 3, 4A, Region 6, and 7. But we're still closely monitoring other regions, including Mimaropa, Region 1, and Region 10, Region 5, and Region 8. So, so far, we haven't had any additional outbreaks reported yet.
Okay, and what does that mean when we say we are monitoring the other regions?
It means we've seen cases in those regions. However, they're still at the threshold, below the threshold compared to the cases that they've had at the same time last year. So we're just checking if there's any continuous transmission of the disease in those areas.
And we're expecting the numbers on a national level. We're expecting the numbers to go up in the immediate term, to go down, to stabilize. What are we expecting?
Well, once we have an outbreak, what we do is we have increased surveillance, and then we manage the cases, and we have outbreak immunizations in those regions. But of course, in the first few days to week, maybe we're going to see still more cases. And then once the outbreak starts responding to our activities, that's then when they level off and then start going down. So it might take 1 to 2 weeks before the outbreaks are controlled and the cases start going down.
Doc, as you know, all of this is ongoing in the middle of parallel conversations about politics and who's to blame and so on. Is it oversimplifying the conversation when people say that it was the Dengvaxia controversy that led to a drop in immunization rates?
Yeah, that's definitely an oversimplification. 2.4 million were unvaccinated. Some of the children come 17. Even as early as 5-6 years ago, we just haven't been reaching our 95% targets for immunization. So we've had an accumulation of unprotected children. Of course, in 2018, there was really a sudden drop. I mean, from 70 to 80%, it went down to 40% coverage, for example, in Metro Manila, and that aggravated the condition. But it's really a lot of factors working together that led to this outbreak. And the important thing now is really just to get the confidence back in vaccines and have the mothers bring their children to the barangay health stations to be protected with the measles vaccine.